My tip for today is to always try to find something in common with the patient. And what I mean by that is when patients come to our practice, many times we're focused on the tooth number, we're focused on their insurance, we're focused on their procedure, whatever it is, we're focused on how they heard about us, whatever it is we need to know or do during the time they're there. But what we tend to forget is that we're dealing with a person. We're dealing with a person many times that doesn't love being in the dental office. We're dealing with a person that doesn't love getting dentistry done, or just in general, a person that comes with those teeth and that mouth and that procedure and that insurance. So slow down and make sure every time you have an interaction with a patient that you find something in common with them. And what I mean by that is to ask them, how is your day going? How was your weekend? What did you do this weekend? Or what do you do for a living? Find something that you can talk to them about, even if it's just for a minute or two, that lets them know you care. It connects you to them. And it puts you and them in the right mindset, which is we care about you as a person. We want to find something about you that Here's my tip. Always try to find something in common with the person that you're dealing with the patient in front of you. So many times we focus a lot on the procedures we have to get done, the tooth number we're working on, what insurance code it is, what insurance plan does the patient have. We forget about the fact that we're dealing with a person. So my suggestion is each and every time you first come into an encounter with a patient, each and every time you first meet a patient, whether they're coming to the practice, you're walking into an operatory, you're sitting down with them in the consultation room, whatever the case may be, that you slow down and you actually talk to them for a minute or two to find something in common with them about. And what I mean by that is, let's say you're meeting the patient for the very first time. Find out about them a little bit. What do they do for a living? Where did they used to live? How many kids do they have? What sports do they love? Find something that you can relate to them with that's more than just dentistry. Find out something that you could say, oh my gosh, I have two kids also. How old are your kids? There you go. You have something in common. And or each time you encounter them or sit down with them or meet up with them, find something in common with them each time. We need to connect with our patients on a human level, and it doesn't take that long. How was your weekend? What did you do this weekend? Oh my gosh, you went to that concert? I love that artist. How was the concert? Found something in common with them. Oh, you went out for Indian food? I just love Indian food. Where do you recommend going? You find something in common. Even if it's beautiful day out there today, isn't it? Yes, that the weather is amazing. You found something in common. But we tend to just talk to the patients about teeth and insurance and dental codes, and we forget about the purpose that we're here, which is to treat the patient in front of us. So take a couple minutes every single time you have an encounter, a conversation, or you meet up with a patient to relate with them, to find out something in common with them. Then you can get into the details of your job or whatever it is you need to get done during that procedure and during that appointment.